chat. Can you guys see this? Wait, why is this? There. Okay, can you see? We good to go? I'm going to check in with Twitch chat. Can you all see that? Okay. All right. So, William, your question is, how do you get fully healed? Right?
Yeah, and where... Yeah, exactly. Yeah.
So, yeah, I'm going to tell you how you can get fully healed. Okay. So, it starts with this. Panch kosha, okay? So you have physical, energetic, and what I'm going to do is break down your quote-unquote diagnosis amongst these. And so you're going to see how all of the things that are wrong with you, not, I mean all, but that's grandiose. So I'm going to show you the different, essentially you've got like 5 layers. And what's going on is that each of your layers has been attacked and damaged in different ways. So the process of full healing actually requires you to heal each of these layers, and we'll sort of, it requires you to heal each of the layers. And then the other problem that I'll try to show you is why you feel hopeless, because the things that you're healing are actually not on the layer that the damage was done. And I'll explain what that means, okay? So the first thing is you have this sense of sluggishness, right? So let's do like diagnosis here, okay? And then let's do like treatment over here. So if we think about sluggishness, do you think that that's physical, energetic, emotional, intellectual, or spiritual? Your body being heavy.
Physical.
Okay, so sluggishness.
I don't know. Actually, no, wait. Wait. It's energetic.
Very good. So it's actually on more than one.
And
okay. Yeah. So let's think about like, so does talking to your psychologist help you with your feelings of sluggishness?
If it helped, yes.
Does it?
I mean, it came back again.
Okay.
But and not as heavy as before as well.
Okay, so this is a good example of like, if we have, you know, emotional treatment here, so if we do medication, that gives us a lot of healing, right? If we do talk therapy, so that's actually the emotional mind, right? So if we do emotional treatments for physical problems, we get a little bit of benefit. But do you see how medication helps way more than talking about your feelings?
Mm-hmm.
So the other interesting thing, okay, so we'll get to that. So the other thing that you can do is, have you ever done Qigong or Pranayam? Do you meditate with us on stream?
I've meditated for a while, yes.
Okay, so there are some kinds of meditation that are called Pranayam, or in the Chinese system. What's your ethnicity, by the way?
Yeah, it's Chinese.
And what part of the world are you in?
Sweden.
Okay. So like if you do pranayam or qigong, these are specifically meditative practices that are aimed at boosting your energetic self or your qi or your prana. Does that make sense?
Mm-hmm.
So it's like not like meditating on, you know, the nature of things or stuff like that. It's not an intellectual meditation. It's like an energetic meditation. So if you guys have ever heard of the Wim Hof method, have you ever heard of Wim Hof?
No.
So Wim Hof is this guy who learned this like form of, I think, Tibetan meditation, where like he can now do things that are physically impossible in terms of like resisting cold. So he'll go and like sit in
that guy.
Yeah. And so the thing is like what he does is like physically not possible. You can't be in hypothermic water for an hour and like not lose fingers, but that's literally what Wim Hof is capable of doing. What Wim Hof does is pranayam. So like this shit absolutely works. There's also data that suggests that doing pranayam actually makes you resistant to heart attacks, which I can go into the physiology of like how that works. But because it's actually really fascinating. The point is that you can actually do things through pranayam and qigong that will boost your energy. I don't know how else to put it, but like when you feel sluggishness, if I were to do blood tests, I may find vitamin D being low, right? So that's an example of something that leads to depression. Low level vitamin D levels lead to depression. It's possible that you're vitamin D deficient. but you just feel sluggish. If I take you to a doctor and they listen to your lungs and I take you to like an orthopedic surgeon and I get him to like test your strength, nothing is physically going to be wrong with your body. Do you get that when you're sluggish?
Mhm.
But
Yeah.
it feels like literally like your sluggishness is an energy problem. And there are some techniques, what the yogis realize is like there are some techniques that you can do to boost your energy because you're not doing something physical. It's like they're working specifically on the energetic body. Another good example of this is yoga or Tai Chi. And there are studies that show that yoga and Tai Chi is superior to exercise at treating things like arthritis. And if you go to people who are experts in yoga and you ask them, why do you think that yoga is superior to exercise? Because in both of them, you're moving, right? So like, why is yoga superior to Tai Chi in some clinical trials? There's a great paper by, for example, Chen Wang in the New England Journal of Medicine from like 2010, 12, where she does a trial on osteoarthritis and compares Tai Chi to exercise and finds that Tai Chi is superior. And so the question is, if both of these are physical practices, scientifically, how is it that Tai Chi outperforms exercise because you're moving your body in both cases? Does that make sense? Like how that you should get the same effect. But clearly, scientifically, we are finding that Tai Chi is not the same as exercise. And if you ask Tai Chi masters, what they say is, yeah, it's because we work on an energetic level, not just the physical one. What does that mean? No one has any fucking idea. Like scientists have been trying to find evidence of chi or prana and they've never been able to find it. All we know is that when you design a practice that's based on this hoity-toity unscientific principle of energy, it actually outperforms purely physical practices. That is a scientific fact. So my point is that in terms of healing yourself, you can do these things, okay? And what that's going to do over time is when you take out the medication, you're going to lose the benefit of the medication. You with me?
Yeah.
But if you do these things in the meantime, this is going to make a very slow plus. Very, very slow. And if you do this for 6 months and then you stop medication, you're going to have like a plus that's left over. And you'll do better without medication. Does that make sense?
Mm-hmm.
Okay. So basically, the thing about energetic practices in pranayama is that they're going to heal you. It's like a regeneration buff. You're going to heal like 1 hit point every week. And so if that's all you do when you're feeling super depressed and sluggish, it's not going to be fast enough for you to notice any difference. With me?
Yeah.
I can't see your face now. That's why I'm asking.
Oh, okay.
And at the same time, it's because I have the iPad pulled up.
Gotcha.
So, actually, but maybe, yeah, I have to have it pulled up. But at the same time, it is going to heal you over time. The other problem is that if you are sluggish, you're not going to have the time or energy to be able to do yoga or pranayama. Does that make sense?
Yeah.
So what we have to do is start with medication so that you feel more energy, and then you use that shield or the artificial energy boost of medication to start to do other things that are going to lead to more long-term healing. You good with that?
Yeah. Yeah.
Okay, now we're going to talk about other things. So then, okay, so this is fine, but is your problem restricted to physical and energetic stuff? No. Where does CPTSD go? And we'll explain what that is in a second. Where do you think CPTSD fits? On the left.
Like emotional?
Absolutely. Okay. So let's explain what CPTSD is. Can you tell us what it means?
Complex PTSD.
And what makes something complex PTSD versus regular PTSD?
An event that continuously happens over a period of time rather than just one event.
Excellent. So let's say that, I'm walking down the street and I walk past some of the riots that are going on, and a police officer shoots a rubber bullet, and I'm carrying my groceries, which actually happened to a lady, and the bullet hits me in the face, and, even people have lost eyes and stuff. So that's a one-time event that leads to post-traumatic stress disorder. All you need is a single event to end up with post-traumatic stress disorder. Post-traumatic stress disorder affects people in particular ways. It's characterized by flashbacks, nightmares, things like that, but their intrinsic sense of self is not necessarily destroyed by a singular event, right? Because if I walk down the street and like I'm Dr. K and I'm like, I feel confident in who I am as a human being, and something traumatic happens to me, that's terrible and it could be destroy me as a human being, but it doesn't have to destroy me as a human being. What complex PTSD is when trauma happens to you over and over and over and over again. So when William tells us that he is an 8-year-old boy who is screaming at his mom to stop and banging his head against a wall, and she continues to yell at him for an hour and a half, and that shit happens day after day after day after day, that is a whole different ballgame from being like shot once or being robbed or being raped or whatever. That's complex PTSD. Okay? So now let's think about what are the treatments of complex PTSD. What do you think medication is going to do for that?
It just gives you this temporary buff that we talked about, like
right. So that's kind of like talking for emotions. Talking like acting on an emotional level for a physical problem only gives you like 1 point of healing. Does that make sense? And so medication for an emotional problem only gives you 1 point of healing. Does that make sense?
Yeah. Yes.
Right. So
I want. Could I add something as well?
Sure.
So I think what we tried to cure was like regular PTSD, so to say, with my psychologist, but and that's why I guess it caused so much confusion why I'm still feeling as I did and stuff like that.
Excellent. So you took the next part right out of my mouth. The real truth is that complex PTSD doesn't go here. It goes here. And this is where PTSD goes. Because with what complex PTSD, what happens is that your sense of a human being gets fucked. That's a spiritual problem. This goes back to Ghost. Why am I here? Right? That's not emotions. Do I deserve to live? Does that make sense? Like, that's not an emotional issue. That's like a spiritual issue.
Yeah,
what do you think about that? Huh?
Yeah, it makes totally sense because it's I mean, it didn't really help me. So to
Exactly.
Say.
So this is why talk therapy is going to be 1+, 2+, or 3 pluses. What do you think?
Yeah, it makes sense.
1+. Right? So your psychologist can help you here if you had regular PTSD. But the psychologist is only going to be a 1+ over here. And this is the biggest problem that I think, actually your psychologist can help you with 3 pluses, but they have to do that kind of work. So this is the biggest problem that I see with like a lot of quote unquote mental health diagnosis is that like, so the reason that I'm an effective psychiatrist is because I actually don't do a whole lot of psychiatry. What I do is a lot of spiritual work because I think people like you, when I said that at the core of your problem, William, is that like you don't even know if you deserve to live. So we can deal with the suicidality and the negative emotions and shame and all that shit. All of that stuff is over here, right? So this is shame, feels bad, man. Right? That's all emotional stuff. And now we get to another problem, which is that you're an analytical guy. So what you try to do is essentially like you use analytical treatments for emotional problems. And this is the worst, is that when you ask yourself, like when you have this feeling of being a ghost, right? And then what happens is you start asking yourself questions about, do I deserve to be here? You start to use your analytical mind to solve a spiritual problem. And that doesn't actually get you shit. Or maybe 1+. Does that make sense?
This is the reason why I can't really listen to it as well. Like the emotions as I feel.
What do you mean? Say more about that.
So like I try to listen to my emotions. Why am I feeling sad and shit right now? But it's more like a constant noise, and it's more because it's on the spiritual level rather than the emotional.
Or Either one. So an analytical approach to your emotions is going to get you, even if it's emotional, the analytical approach is not going to help very much. And if it's spiritual, it's not going to help very much. The whole reason that people like you have trouble getting fully healed is because your treatments do not line up with the sources of your problem. Right? For a physical problem, you need a physical treatment. For an energetic problem, you need an energetic treatment. For an emotional problem, you need talk therapy. For complex PTSD, you need to figure out, why am I here and how do I deserve to live? That's not going to happen through talk therapy. That's going to happen through something like meditation. Right? And how does meditation help? You have to sit and you have to feel that like it's kind of hard to describe. Or happiness in a relationship. Right? So during the good years with your girlfriend, because where does happiness in a relationship go here? It's not just emotional. Maybe it's emotional, right? So maybe it goes over here too. I'm not really sure. Okay. But the key thing is that I think when you were happy in the relationship, the reason that you felt more human and less of a ghost, the reason you saw the world in color, is because she gave you a sense of belonging. What do you think about that?
No, for sure, for sure.
And so what happened is she answered this question for you. Do I deserve to live? And the way that she interacted with you as a human being made you think that the answer is yes. And as the relationship declined, your sense of deserving to live was still young and fragile. So 2 years of a relationship with a shy girl who doesn't understand quite as much about life as, let's say, someone else does, could not strengthen you enough. She couldn't do, in 2 years of loving you and making you feel like you belong, she could not undo 22 years of emotional damage and complex PTSD, which makes perfect fucking sense. Right? Yeah. And then when the relationship goes sour, it's not enough. And so can you be fully healed? Absolutely. Now I feel confident because I've talked myself into it and I've convinced myself. And the way that you get fully healed is that you do this. And this kind of goes back to earlier when I was saying, okay, like it actually, like you have lots of different problems. Absolutely. And so fully healed doesn't come from medication. It comes from all of this shit because you have shit going on every part of your being. Right? The only thing that I'm not sure is it doesn't sound like you have an intellectual problem.
What is that exactly?
So I don't hear like strong cognitive biases about the way that you view yourself. Right? So like some of the people that I talk to, like a good example of this, like a couple weeks ago, we interviewed Sweet Anita. And Sweet Anita felt like she doesn't deserve to like take care of herself. So cognitive bias goes over here.
Oh, I guess I've worked a lot on that part.
Absolutely. And that's why I don't think we see it. Because you did CBT or a psychologist.
Yeah.
Right?
Self-compassion helped a lot, extremely a lot. And meditation helped a lot in that part too.
Yep.
I would say. Right?
So so let's just think about this. So in emotion creates a cognitive bias. Does this make sense? Like the emotion is on the emotional level, and then you feel like you're a piece of shit. And then your analytical mind creates justifications for why you're a piece of shit. But that's a separate part of your mind. And you can use self-compassion. Sorry, guys, this is getting messy. So self-compassion is going to target this. And CBT, which is cognitive behavioral therapy, is going to target the analytical construction based on the root of your negative emotion. Does that make sense?
Yeah.
Okay. Questions?
You wrote meditation at the spiritual. It's any kind of general meditation or what?
Nope.
I have been meditating for quite a while.
Yep. So you need to do meditations that are geared towards discovering your sense of self. So this is because like this, people call this meditation too. Self-compassion, like metta meditation, is over here. So that's like self-compassion, like loving kindness meditation,
Yeah.
right? So there are lots of different kinds of meditation, and they work on different levels. There are also some meditations, like I'll ask people to do investigative meditations, like what is the sound of the breath? That's like a kind of an intellectual meditation. So you need to do like, who am I? And in particular, there are a few powerful mantras that will help you answer this question.
Okay.
But that's the kind of I'll teach you something today. I just got to think about this. The first thing that I need to do is check in with you, though. Does this make sense?
It makes a lot of sense. Yeah, I'm actually really happy to actually even see it in picture and noticing and seeing the parts, like, because I believe I've come really far away even in these like 21 years. Even though I have like aimlessly gone somewhere, I think it still learned me something along the way, and it makes sense when adding everything. Because yeah, it's maybe it's more like all these sections I have to work on, and there's like one last piece I haven't, which I guess is like the spiritual, which I haven't really uh dealt with. Um so
Uh,
yeah, it actually makes much sense, and yeah.
and so here's why I think your hopelessness is completely understandable. Because when you have complex PTSD and you go to a professional and they give you a medication, that's not going to work. And so basically the basic problem that I think the reason that you're hopeless, and it's not your fault, I think you've actually done remarkably well given the hand that you were dealt. It's actually fucking amazing. Is that you're like, all of your treatments are like all over the place. You're trying to solve stuff with some koshas from like other koshas. And so your effect size, it's going to be kind of like I'm continuously like trying to heal your right arm, even though the damage is in your left leg. And the issue is that you get a little bit of bandwidth. You get a little bit from here, you get a little bit from here. And then over time, though, it feels like that's not really working because you're not targeting
Right.
your treatments towards what you've done. Or actually, that's not even entirely true. Because I think you've actually, like, because you had problems here and here too. It's just you've actually found good treatments, right? So you had emotional feelings of, and this is exactly why it's beautiful. So you had emotional feelings of shame, and then you say self-compassion helped with that. And this is the mistake, this is the diagnostic mistake that people make. When someone has complex PTSD and they're filled with shame and they get treated with self-compassion, they think they are fixed, but they're not fixed because they never got to this. Right? And so then you get hopeless because you said, okay, I have complex PTSD. I have all these negative emotions. I learned self-compassion and I'm not fixed. And then hopelessness is completely reasonable because complex PTSD, you thought you did the treatment for complex PTSD and you're not better. And so then you're hopeless. Absolutely, man. You should be hopeless because you thought you did what you needed to do and you did a lot, which you can tell us, and you're like, hey, I actually grew a lot there. Hey, the medication's actually really helping. And you're not fully healed. And so then your question is beautiful. Now we come back to your original question. Can I become fully healed? And the answer, and it's completely reasonable for you to ask that question because you did this, and you did this, and you talked to a psychologist, and you found yourself not being fully healed.
Yeah.
And then you start to question. You're like, if I talk to the psychologist more, if I add on more medications, or if I learn more self-compassion, will I be fully healed? And the thing is, you actually know the answer to that, Will. And the answer is no, you're not going to be fully healed. Not from that.
Yeah.
And so
Yeah, I feel like this picture and the overview, it feels like it can capture kind of any problem, I guess. And
absolutely.
like it's an overview of everything, basically.
Yes. And this is what the yogis learned. They said that a human being can be divided into these 5 layers. And that an attack on one layer deserves a treatment on that same layer. And that a strong Gosha or one strong layer can buffer or protect you from other layers. So when I deal with people with cancer, right, that's a gigantic attack on the physical and the energetic. And if they are deeply spiritual people and have a lot of emotional support, they do way better.
Mm.
When your grandmother, so grief is an emotional attack, right? It's a different color.
Yeah.
So grief attacks you here. And so when that happens, your physical, it almost reverberates. So you get energetic damage and you get physical damage. And there are studies that show that if someone loses a loved one and I give them a vaccine, their immune response to the vaccine is lower. Essentially, vaccines become ineffective in people who are in grief. And that's a physical effect based on an emotional insult. It's an energetic effect based on an emotional insult. When you go to see your grandmother and she's not there on the inside, that's an emotional blow which contributes to your sluggishness. Do you see that?
Mm-hmm.
And so it's all connected. And so the cool thing is that you can like strengthen one area and it'll kind of protect you from the others. And that's how like people, this is where resilience comes from. So somewhere in here, William, I think you're actually very strong intellectually. And that has basically been like how you stay alive. Because you've been emotionally fucked. You've been, I don't know if like you're physically active or whatever. Maybe you're strong physically as well. But like spiritually, like, you know, something's been missing and you've just basically, your intellect has been like carrying the rest of your sheaths. And that's why you're alive. Because somewhere in there, there's something here that is like, you know, keeping you going.
Mm.
Okay. Final questions, thoughts?
No, I'm actually really, really happy and glad.
Cool.
Yeah, I didn't expect too much because I felt very hopeless and stuff, and I did